A growing consensus among health experts agree that being outdoors may be the safest place to be during the COVID-19 outbreak. New findings revealed this week that sharing indoor space actually creates a major infection risk because when people speak, droplets containing the virus stay in the air for up to 14 minutes. Joining us to discuss is Carrie Lestage, the COO of BioPlanet and cleaning expert, and Dr. Eric Mandel, the medical director at Mandel Vision. Good to see you both. And Doctor, we'll hear from your medical opinion on this first. Would you mind reminding us the benefit of being outdoors in response to the COVID-19 outbreak?
Okay, so just for a little perspective, because sometimes we get lost in the weeds here, we remember we're trying to contain this virus to keep a transmission rate under 1, and because the COVID virus will be around until we have herd immunity. So why is outside better than inside? Because outside, with a little bit of wind, we disperse the virus. It is much safer. Indoors, poorer circulation. We're going to be breathing it in. We saw actually when Governor Cuomo last month mentioned that he was shocked that people indoors were getting the virus more than people outdoors. And that's because when you go bring in people from outside who have the virus asymptomatic near vulnerable people, they're going to get sick. So it's very important. And this goes, we spread the virus by talking, singing, sneezing, coughing, spitting, and it could stay out in the air. So we need to have better ventilation, circulation, and we get into the AC season, it's going to be a little bit more problematic because remember, cold and dry are better for the virus to survive. So the key here is outside is good, but we still need to use masks to prevent us, the people with the mask on, from spreading it if you're asymptomatic, and social distancing so you can decrease the load of droplets that you might get in.
Yeah, and as states begin to reopen, it seems like more and more people will be able to get outside and go to the parks and potentially really put this plan into action here. Carrie, you know, for those of us who are working inside or staying inside or really don't have much space to work with, you know, if you're living in New York City, your apartment just isn't that big likely. So how do you keep that space clean? How could you go about disinfecting it to make sure that you aren't spreading COVID-19 in your home?
So I think one of the most important things that we can do is make sure that we pay attention to those high touch areas. And those are your doorknobs, your faucet handles, anything that you're regularly touching. It's also important to remember that as you are going out to the grocery store or you're ordering food in, anytime that you're interacting outside of the home, that you're very conscious about making sure that you're washing your hands regularly, that when you do bring those germs home with you, because you will, that you make sure that you're very aware of where you're touching and that you disinfect those surfaces immediately after you get back.
What about even the clothes that you wear or the shoes that you wear when you're outside? Would you recommend taking those off, not bringing those in the home as well?
I think it's a good practice anyway to remove your shoes before you come into the house anyway. But I think in this particular case, I think it's generally a good practice. I think that if you're living with somebody who is particularly susceptible to this virus, that it would be a good idea to try to limit any sort of exposure. And so if, you know, I've seen many reports of nurses and doctors that have come home and before they've entered the home that they're removing their work clothing before they interact with their family. So in general, I think that would be a good idea. Now, the layperson who may not necessarily be exposed to a hospital or something along those lines, I think that it may be overkill to think that you have to remove your clothes, but certainly washing your hands and disinfecting those high-touch surfaces is a great practice for everybody.
Yeah, some good tips to keep in mind. Very important. Doctor, would you mind reminding us, you know, the effect that UV light has on COVID-19 and the virus as well?
So we're talking UVC.
Well, doctor. Go ahead. Dr. Mandel.
We're talking about UVC. There's UVA, UVB, UVC. UVC, we do know, kills the genetic material and some of the protein on viruses, so it will be helpful. The question here is seasonality. As UV light increases here in the Northern Hemisphere, will it decrease the virus? And as humidity goes up, we know the virus doesn't do as well. So there is something there. Hospitals have used UV, before to clean large surfaces. I just wanted I think UV is something to consider. It's not an answer. I think what Kerry was talking about as far as, cleaning, disinfecting with the right products and following them for the EPA guidelines, and also something called dwell time. We want to make sure that we let the product stay on the surface long enough to kill the virus or whatever bacteria or germs you're trying to get rid of. Here, obviously, it's a virus. So UV, I think, is a factor, but I don't think it's the primary thing that you should not think of as a disinfectant.
Okay. All right. Some great advice there. Good things to consider, good tips to keep us all safe during this time. That's Dr. Mandel and Kerry Lestage. Thank you both so much. We appreciate it.